So we shall continue with the program. Now we have a pioneering video call by Dr. Hopefully I will pronounce it correctly, Dr. Joep De Ligt, and he will discuss the discovery of CTNNB1 syndrome. Thank you.
Am I coming through?
Yes, we can hear you.
Okay.
We will have your screen enlarged, so if we can do that. Excellent. We have you on the big screen right now. So did I pronounce your name correctly?
Close enough. It's a difficult Dutch name, but Sedravo, everyone. Thank you for inviting me to come along. First of all, I would like to join the others in thanking you for making this happening, but also specifically the parents and their children that make these things possible, because we would not have been able to find those initial cases and find the gene if those parents and patients had not collaborated with us. So please take a moment to congratulate yourselves on being here today and on making these things happen. Yeah, as they indicated, I was asked to talk a little bit about how this journey started for us. So I was a relatively young researcher that wanted to work on DNA, and preferably in a place where eventually it would do some good. So I joined the Radboud Hospital in the Netherlands, where some patients were included that had early onset disabilities. And we wanted to understand if possibly the explanation was in their DNA. So we were able to look at the DNA of the child as well as of the parents. And we saw that in some of these children, this particular gene had a change in it. And it was really, for us, yeah, it might sound strange, but exciting that we might have found a sort of a diagnosis for these patients. And then that gene was evaluated in many more patients, and we found a couple of others. And that is, well, the start, at least, of the scientific journey, that you have sufficient patients that then, on the DNA level, have a similar difference. And that can then be evaluated by the clinician to see if there are similarities or differences, just like what is happening at the moment at the conference. And it's always the hope of a scientist like myself that at one day there will be a treatment. So it's really honoring and inspiring for me to be here today briefly, to hear about how you're moving towards a potential treatment and how you're coming together to make that happen. Because individually, this disease might be rare, but collectively you have the power to do some real good. So that's really exciting to see sort of that story almost come full circle now. And I think also with the technologies changing, hopefully it will also be easier to diagnose children on an earlier age, and if there is then a treatment, to intervene quickly to minimize the effects of that change in the DNA.
Dr. De Ligt, thank you very much. I would like to stress to the audience that you are actually the discoverer of this syndrome. We think, not just think, we are very grateful, all of us. And you mentioned the full circle. The full circle closes next year. So it closes when the drug comes, but it has to be safe. It takes a long time because we don't want to hurt any child. And we are entering new territory, and this territory depends sometimes on single people, like, discoverers. And Dr. De Ligt is the one who started because he discovered this syndrome. With that, Dr. De Ligt, hope to meet you in Ljubljana sometime soon. Which institution are you coming from, just to be curious a little bit?
Yes, so currently I'm working on cancer. So I'm now at a foundation in the Netherlands that is trying to make a personalized cancer treatment a reality, the Hartwig Medical Foundation.
Thank you. Keep on doing the good work and hope to see you sometime in Ljubljana.
Thank you very much. Have a great day.